Today, we're diving deep into the lesser-known dark side of pomegranate juice. While this antioxidant-rich beverage offers numerous health benefits, understanding its potential side effects is crucial for making informed decisions about your health. Let's explore these 10 important side effects that every pomegranate juice consumer should know about. And stick around until the end because I'll reveal the exact safe amount you should consume daily to avoid these risks. Side effect. Number 1. Dangerous drug interactions. One of the most serious concerns with pomegranate juice is its ability to interact with prescription medications. This isn't just a minor inconvenience, it can be life-threatening. Pomegranate juice affects how your liver processes certain medications, specifically those broken down by enzymes called cytochrome P450. If you're taking blood thinners like warfarin, pomegranate juice can increase your bleeding risk by enhancing the medication's effects. This interaction occurs because pomegranate juice decreases how quickly your body breaks down warfarin, essentially making the medication stronger than intended. Similarly, if you're on statin medications like rosuvastatin for cholesterol management, pomegranate juice can increase the drug's concentration in your bloodstream. In rare cases, this can lead to rhabdomyolysis, a serious condition where muscle tissue breaks down and can cause kidney damage. Other medications that can interact dangerously with pomegranate juice include certain antidepressants, pain medications like codeine and tramadol, and various heart medications. If you're taking any prescription drugs, consult your healthcare provider before adding pomegranate juice to your routine. Side effect number 2. Blood pressure complications. While pomegranate juice can help lower blood pressure in people with hypertension, this effect can become problematic for those already taking blood pressure medications or those with naturally low blood pressure. The combination of pomegranate juice with ACE inhibitors or other antihypertensive drugs can cause your blood pressure to drop dangerously low. This condition, called hypotension, can lead to dizziness, fainting, and in severe cases, shock. If you have low blood pressure naturally, drinking pomegranate juice regularly could worsen your condition, leading to symptoms like fatigue, lightheadedness, and difficulty concentrating. Always monitor your blood pressure if you're consuming pomegranate juice regularly, especially if you're on any blood pressure medications. By the way, please help our channel grow by clicking subscribe. Side effect number 3. Blood sugar fluctuations. Despite some studies suggesting pomegranate juice may help with diabetes management, the fruit contains significant amounts of natural sugars. One pomegranate contains around 39 grams of sugar, and pomegranate juice concentrates these sugars even further. For people with diabetes or prediabetes, this high sugar content can cause blood glucose spikes, especially when consumed in large quantities or on an empty stomach. The removal of fiber during the juicing process eliminates the natural buffer that would normally slow sugar absorption. If you have diabetes and want to include pomegranate juice in your diet, it's essential to account for its sugar content in your meal planning and monitor your blood glucose levels closely. Consider diluting the juice with water or consuming it with meals to minimize blood sugar impact. Side effect number 4. Digestive disorders. Excessive consumption of pomegranate juice can lead to various digestive issues. The high fiber content in whole pomegranates is beneficial, but when concentrated in juice form along with natural sugars, it can cause problems. Common digestive side effects include nausea, vomiting, abdominal pain, and diarrhea. These symptoms typically occur when consuming large amounts of pomegranate juice, particularly on an empty stomach. The high fructose content can be especially problematic for people with fructose intolerance. Some individuals may also experience constipation due to the concentrated nature of the juice and its effects on bowel movements. The symptoms usually subside after a few hours, but chronic overconsumption can lead to ongoing digestive discomfort and irritation of the gastrointestinal tract. Side effect number 5. Allergic reactions. While not common, pomegranate allergies do occur and can range from mild to severe. People with existing plant allergies are at higher risk of developing pomegranate sensitivity. Mild allergic reactions may include itching, skin rashes, hives, and facial swelling. More severe symptoms can include difficulty breathing, throat swelling, and anaphylaxis in extreme cases. Some people experience what's called oral allergy syndrome, characterized by painful swallowing and swelling in the mouth. If you've never consumed pomegranate juice before, start with a small amount to test your body's reaction. If you experience any allergic symptoms, discontinue use immediately and seek medical attention, especially if you have difficulty breathing. Side effect number 6, heartburn and acid reflux. Pomegranate juice is quite acidic, with high levels of citric and malic acids. This acidity can trigger heartburn and gastroesophageal reflux disease, GERD symptoms in susceptible individuals. The acid in pomegranate juice can directly irritate the delicate lining of the esophagus, causing that familiar burning sensation in your chest. Unlike whole pomegranates, which contain fiber that can help buffer acidity, pomegranate juice delivers concentrated acid without this protective element. If you're prone to acid reflux or GERD, pomegranate juice might worsen your symptoms, especially when consumed on an empty stomach or in large quantities. The problem can be compounded if you lie down soon after drinking the juice, as this allows acid to travel up the esophagus more easily. Side effect number 7, weight gain and high calorie content. While pomegranate juice is often marketed as a health drink, it's surprisingly high in calories. The concentrated sugars in pomegranate juice can contribute significantly to your daily caloric intake, potentially leading to weight gain if consumed regularly in large amounts. Unlike whole pomegranates, which provide fiber that helps you feel full, pomegranate juice lacks this satiety factor. This means you can consume a lot of calories quickly without feeling satisfied, making it easy to overconsume. For people trying to lose weight or maintain a healthy weight, the high calorie content of pomegranate juice can be counterproductive. A single cup of pomegranate juice contains approximately 134 calories, which can add up quickly if consumed daily. Side effect number 8, liver enzyme interference. Pomegranate contains compounds that can interfere with liver enzymes responsible for metabolizing various substances. This interference can affect how your liver processes not only medications, but also other nutrients and compounds. For people with existing liver conditions or those taking medications for liver disorders, this enzyme interference can be particularly problematic. The compounds in pomegranate can hinder the functioning of certain liver enzymes, potentially affecting the liver's ability to detoxify the body effectively. If you have any liver-related health issues, it's crucial to consult with your healthcare provider before incorporating pomegranate juice into your diet regularly. Side effect number 9, dental health concerns. The natural acids and sugars in pomegranate juice can negatively impact your dental health. The acidic nature of the juice can erode tooth enamel over time, making your teeth more susceptible to decay and sensitivity. Additionally, pomegranate juice can stain your teeth due to its deep red pigments. Regular consumption without proper dental hygiene can lead to permanent discoloration that may require professional dental treatment to remove. The combination of acid erosion and staining makes pomegranate juice particularly problematic for dental health. To minimize damage, rinse your mouth with water after consuming pomegranate juice and wait at least 30 minutes before brushing your teeth to avoid brushing away weakened enamel. Side effect number 10, pregnancy and breastfeeding concerns. While pomegranate juice is generally considered safe during pregnancy and breastfeeding, there are important considerations to keep in mind. The safety of pomegranate extract and other concentrated forms during pregnancy hasn't been thoroughly studied. Some traditional uses of pomegranate included inducing abortion, though this typically involved parts of the plant other than the fruit. However, this historical use raises questions about consuming large amounts during pregnancy. Additionally, the high sugar content in pomegranate juice can be problematic for pregnant women with gestational diabetes or those at risk of developing it. The concentrated nature of the juice makes it easy to consume large amounts of sugar quickly. If you're pregnant or breastfeeding, it's best to stick with moderate amounts of pure pomegranate juice and avoid concentrated extracts or supplements. Always consult with your healthcare provider about including pomegranate juice in your diet during pregnancy. So, What's the safe amount of pomegranate juice to consume? Based on scientific research, most studies that showed benefits used between 150 to 200 milliliters, about 5 to 7 ounces, of pomegranate juice daily. However, for most people, limiting intake to about 4 to 6 ounces per day is considered safe and beneficial. It's important to choose pure, unsweetened pomegranate juice without added sugars. Consider diluting the juice with water to reduce its acidity and sugar concentration. If you're new to pomegranate juice, start with smaller amounts to assess your body's tolerance. Remember, moderation is key with any food or beverage, even healthy ones. While pomegranate juice offers numerous health benefits, being aware of these potential side effects ensures you can enjoy this nutritious beverage safely and responsibly. Always consult with your healthcare provider before making significant changes to your diet, especially if you have existing health conditions or take medications. Your individual health circumstances may require special considerations when it comes to pomegranate juice consumption. If you found this information helpful, please give this video a thumbs up and subscribe. We upload a new video every Friday at 12 p.m. Eastern Standard Time.